High value action number 4, finding a primary care provider. If we were live audience, I would probably do show of hands after we said app download or portal registration. What is the action that most people are focused on after that? It's almost invariably primary care provider. And we know this, again, similar to the digital relationship established with portal registration, that in-person relationship or just having that one touch point with a primary care provider feels like the gateway to participating in the system in a healthy way. All of a sudden, all the lights go on, both with the member as well as with health plan systems of here's how we can coordinate care to get to these people. But it's got to start with we just shake their hand and see them in person. And so identifying that primary care provider becomes really important for that reason at kind of a human level. We also know that this is a place where there are definitely perceived barriers of, well, it's going to be hard to do, or that sounds hard to schedule, or I don't know how to pick a good PCP. We can get in front of those things. And some of the stats like you're looking at, even just including the name of somebody who's in network can drive lift on setting that first appointment by up to 30%. So little ways that we can have personalization can end up with a really outsized participation rate. Okay, so let's think about that. 30% increase by doing something relatively simple, putting that within a correspondence, getting that PCP's name in front of someone. And now think about some of these measures on the star side. And if we looked at a 30% increase in likelihood that someone takes that first action, can we fall into some of these star measures that have razor thin differences between 4-star and 5-star, between 3-star and 4-star? You start to connect these dots and it's, man, we can do little things on a communication side. And I bet we can bump up our annual flu vaccine uptake. I bet we can start having a conversation with everyone that has that first interaction with their physician of how do I reduce fall risk? Because if I'm sort of going behind the scenes of this fall risk measure, the calculation on this is actually just that the clinician had the conversation with the member. That's what we're looking at grading as a criteria. So this isn't even going into the home, assessing environment, anything like that. Just getting people in front of those physicians who we know are going to be going through these questionnaires as part of doing sort of patient onboarding. We're having a great opportunity to sort of nudge our numbers up just a little bit with each of these. So super, super important. Again, this is where almost every health plan is saying, if someone doesn't have a PCP identified or they haven't been to that PCP in the last 2 years, that's where we've got to start asking people to take that action. And when we do so, again, some of the places that we can focus, audience dependent and completely dependent on if people are engaged already or not. But one, let's show people that it's actually easy to schedule this appointment. So access and ease. If you leaned on 2 words throughout the entire year, you'd probably get more mileage out of demonstrate access and demonstrate ease of use. Showing people how this can really be empowering. Oftentimes there's a sense of, I think I'm sick or I know I'm sick. And so there's kind of something to hide, but really using this as an opportunity to partner and create a sense of empowerment in that person of, there are so many resources here. If you get engaged with us, we can start to help you feel better, meet that goal, whatever those things are. And last place I'm going to focus on this one is that tech enablement. So, the proliferation of ways, either external partners or even homegrown solutions within health plans of how do you reach a PCP without having to go into the office. I think those can be really potent ways, especially as we start to do potentially some, data cuts on a population's either health history, or if, for example, if you have somebody that's in a much older part of the population and it's just a subscriber, they may not have someone else that is sort of supporting their care. That can be a great place in some instances to talk about some of these different modalities to reach them.